Hi everyone. Today our video is about the assessment of mental health. So in that we need to write the history collection for patient, and we need to do the physical examination, and also we have to check for a mental status examination and mini mental status examination. So these all are included in mental health assessment. So first thing we are going to discuss now is history collection. So in this history collection, first we need to mention the identification of data. So this identification of data includes name, age, sex, religion, education, occupation, income, marital status, OP number, IP number, ward and unit, diagnosis, doctor, date of admission, date of discharge, days of duration, and address. So these are all the information we need to collect in a identification data. So next thing is informants. So in this informant, we need to write the list of informants who are giving adequate and reliable information. So with the patient, the attenders who are having attenders are nothing but the family members who are having with the patient. So those all the family members will come under informant. So we need to mention in this box like a serial number, name of the informants, relation, adequate, and reliable. Okay. So in this box, we need to mention the informants list and relation to the patient. So if there, for example, if the father of the patient, we need to mention father, mother of the patient, we need to mention mother or sister or brother, anyone else. Okay. So this is about informants. And next third thing is chief complaints. So in this chief complaints, first we need to take complaints in the patient own words. So by asking the patient, we need to collect the information from the patient first. Then both the patient and the informant version should be recorded. First thing we need to collect from the patient, and next thing we need to collect the information from the informants also. So this both the information we need to be recorded. And next thing, patient present illness. So present what illness the patient is having, that we need to mention, and duration of the present illness. So illness is up to which days or whatever it may be, duration of the present illness we need to record. And predisposing what factors, what are the reasons for a illness. Okay, so that also we need to mention in a chief complaints. Okay, next thing is history of the patient in present illness. History of the present illness includes present chief complaint should be explained in detail. So whatever the complaints patient has given, so that complaints we need to explain in detail here. And next, description of the present abnormal behavioral problems. So what are the behavioral problem the patient is having, how the patient is behaving with the nurse. Okay, that description we need to mention here. So for example, like a suicidal attempts, suicidal thoughts and speech, descriptive behavior, mood swings, abnormal perception, like this. So these are the examples for a behavior how the patient is feeling. Okay, so this we need to mention in a present illness. Next, past history. So past history of the patient, it includes past psychiatric history, medical history, and past surgical history. Okay, so in this we need to mention any serious medical illnesses and neurological or surgical illnesses, and any accidents, any hospitalizations, nature of treatment received. So for the hospitalization, what the patient has taken the treatment, that also we need to mention in this. And next, history of psychotropic medication, alcohol and drug abuse or dependence, and psychiatric hospitalization, and history of head injury, convulsions, unconsciousness, DM, that is diabetes mellitus, hypertension, coronary artery diseases, etc. So about this all the conditions we need to collect the history from the patient. And next, past psychiatric history and past medical history also you need to collect. Okay. And next history is family history. So this family history, in this family history, first we need to collect the pedigree chart, that is family structure. Okay. So in this family structure we need to draw the three generations of a family. Okay. So in this we need to mark the patient also. Okay. So next history is family history. So in this family history we need to collect the history like any similar psychiatric illnesses within the family and the major medical illnesses, alcohol or drug dependence, and current social situation, that is socio-economic status of the family. Okay. So this all the information we need to collect in a family history. And next history is personal history. So in this personal history we need to collect the information from the birth to the till now. Okay. So that means first thing is perinatal history. So in this perinatal history we need to collect the information about the antenatal, intranatal and postnatal of the mother. Okay. So in this antenatal history of mother during the antenatal period, that means patient mother has undergone any complications during the antenatal period, or whether she has taken any extra medications for any illnesses. Okay. Is there any complications during the antenatal period, that all the things we need to collect in a antenatal period. And next, intranatal period, type of delivery. So which type the delivery has undergone, that is it, whether it may be LACS or whether it may be normal delivery or a forceps delivery, or whether she has undergone any complications during the internatal period, that also we need to mention in a intranatal period. And next, postnatal period. In this postnatal period also we need to collect the information regarding the about complications of postnatal period, any birth defects or any convulsions during the postnatal period. Okay. And next, childhood history. So in this childhood history we need to ask the patient about the developmental milestones and thumb sucking, nail biting, food habits, etc. Developmental milestones are nothing but the developmental stages. Okay. From the childhood to till adult. Okay. Or whatever the age the patient is having now. So throughout the journey from the birth to the till now, birth to till now, what are the changes the patient is having, that all the things we need to collect in a developmental milestones. And next, thumb sucking, any habit of thumb sucking, any habit of nail biting and any food habits, etc. Okay. So these all the things we need to collect in a childhood history. Next, educational history. So in this educational history we need to collect the information about the age of beginning and finishing of education, academic achievements, any school phobias, learning difficulties. So, what is the age of the patient at the beginning of the education and finishing education, academic achievements, how the patient has achieved the academic years of the school age. Okay. And next, any school phobias. Phobia is nothing but fear. So whether the patient is having any school phobias, and learning difficulties, how the learning process has gone for the patient. Okay. That all the things we need to collect in a educational history. And next, play history. So in this play history we need to collect about the relationship with the peer groups, that means friends. With the friends, how the patient is having the relationship. Okay. And next, puberty. So in this puberty we need to have information about the age of menarche, any anxiety related changes. Okay. So changes are a menarche changes. So at the age of menarche, whether the patient is having any anxiety or any tensions related to that particular changes, we need to collect the information. And next, menstrual and obstetrical history. So in case of female patients we need to collect the information about the menstrual history. So that is regularity, duration, abnormality, and dysmenorrhea, etc. Okay, so whether the periods are regular or duration, how many days the patient will be having the menstrual cycle, and any abnormalities within the menstrual cycle, or any dysmenorrhea history, etc. Okay, so these all the things we need to collect. And next, occupational history. So in this occupational history, age at the starting worker. So at which age the patient has started the job, that we need to mention. And job satisfaction, whether the patient is having the any job satisfaction or not, that also we need to collect. And relationship with the authorities and peers, that means during the job the patient, how he had the relationship with the authorities and the other colleagues within the job, that also we need to mention. And income details. Okay, so this is occupational history. And next history is sexual and marital history. So in this sexual and marital history, we need to collect the information about the types of marriage, that is whether it is arranged marriage or love marriage, whatever marriage it, or consanguineous marriage. Okay, so these all the types we need to ask the patient, and we need to mention in a type of marriage. And next, sexual information with the partner and adolescent sexual activities. Okay, so this history we need to mention. And next, premorbid personality of the patient. Okay, so in that, first thing is interpersonal relationship, how the patient has maintained the interpersonal relationship with the family. Okay, and with the peer groups, and with the friends, etc. Okay, and next, use of leisure time, with the patient is having leisure time, how he is going to spend the time. Okay, so that we need to mention. And predominant mood, how the mood of the patient, any mood swings are present, or any mood changes. Okay, so that mood disorders, if the patient is having any mood disorders. Okay, so any flight of ideas, that all the things we need to mention in a predominant mode. And next, attitude to self and others, how the patient will be for the self and others. And attitude to work and the responsibility also you need to mention. And religious beliefs and normal attitudes, if the patient is having any religious beliefs and attitudes also you need to mention. And fantasy life is nothing but daydreaming. Okay, so that also you have to ask for the patient. And habits, any other habits the patient is having, that also you need to take information from the patient. Okay, so this is up to the history of the patient. And next thing is physical examination, you have to do the physical examination for the patient. So in this physical examination, as you all know, we have a steps, that is head to toe assessment and review of systems. So in this head to toe assessment, we need to do the examination, which include the inspection, palpation, percussion, and auscultation. Okay, so based on these four steps, we need to do the physical examination of the patient, and we need to do the examination for the review of systems also. Okay, and next, apart from this, still we need to add the information about the mental status examination and mini mental status examination. So this mental status and mini mental status examination I'm going to explain in the next video. Thank you for watching. Thank you.